Hey guys, we're doing a little different version of Trooper Steve on patrol. Thank you for joining us live over at News 6 Plus, clickorlando.com, and of course the News 6 app. Now, it wouldn't be Trooper Steve on patrol if I didn't have Results 1 with me, so of course Results 1 is here. But it is day one of National EMS Week throughout our country, where we get to recognize these amazing medical professionals that represent the community all over the country. And here in our community, we have some really awesome personnel that have some awesome tools. I'm talking the ORMC Air Care team. And the Air Care team has got one of my best buds on it, my buddy Trey Augenblick. He's a flight nurse there. We've been best friends since 6th grade, so they're actually showing up right now. Let's take a look. What you're watching here is Air Care landing here at News 6 on our helipad, and none other than my buddy Trey Augenblick, the flight nurse, going to be joining us here for this live stream so that we can kind of hang out and have a little discussion here. Got his swag on. What's up, brother? How are you, man?
I'm doing
You
well.
better not call me Trooper Steve, dude.
Come on. in this atmosphere.
We'll hang out right here. Oh,
See you.
guy. For a second there, I thought he was bringing me some swag.
Well,
Maybe next.
yeah.
He's my buddy. I'll be like, get me an Air Care hat there.
Get you a patch, coin.
Dude, you've got the coolest job in the medical world. Do you think? Would you agree with that?
It definitely has the coolest entrances anywhere you go.
So I was telling people that we are celebrating EMS Week throughout the country. Right now, today is day one, and what better way than to fly in a helicopter to really show and talk about what you guys do on a daily basis. And you just showed up in a helicopter, man.
To kick it off, yeah, EMS Week. This is great. Really, we work with the community, with all the EMS agencies, the police, firefighters, and it's a great asset that Orlando has that we're able to provide for the community.
Now, Trey, did you ever think, and I know the answers to this because, hey, I was telling some of the behind-the-scenes folks how you and I actually practiced for days and hours in your garage when I lived with him for this specific job.
For the interview.
Right.
Oh, my gosh.
So talk to me a little bit about what motivated you to even want to do EMS or medical world, but let alone get in a helicopter.
To be part of it. Stephen, you know this.
He just Stevened me.
So it started, my dad was a firefighter for Disney, for Reedy Creek. And when I was little, he would take me on the fire trucks, and I would see the ambulance and get to see in the back. And it created a spark in me. That's, years ago when I went to church one day, the pastor said, if you got a pulse, you got a purpose. And it's just finding that purpose. And once I realized that the medical field is where I want to be, I went to EMT school, went to Firefighter Academy, and I couldn't get in.
Right.
I have a bad heart. You know that. So I said, I'm just going to keep...
Hold on. He's got a good heart, but he's a good dude. But at the time, medically, they wouldn't let you into the fire academy.
They wouldn't let me in. Right. So I said, well, the next thing, I was going to go to paramedic school. I'm just going to keep on that path. That's the way I want to go. And when I was in medic school, we were sitting out there, and here comes the same helicopter. This exact one flew down, and I said, that's it. That's how I get to be and work with the EMS agencies and work out in the field in my community. That's my purpose. I got it.
Now, like, everybody sees stuff like this, whether you're a firefighter, a medic, a medical assistant, and yeah, you could really want to do this, but it does take motivated and really highly skilled nurses and pilots in order to be part of the air care team. Like, I know Trey's a humble dude, okay? He's never been one to smack talk or anything like that, but I've always come in and be like, look, they hide their superhero capes inside the flight suit. That's why they're red, so that they can camouflage. He's got it back there somewhere. But, like, talk to me a little bit about what separates a flight nurse from a nurse. And I don't, it's not to put anybody different, but it does take a certain set of skills in order for someone to be accepted to the air care team.
Absolutely, sure. Well, I think of the helicopter as kind of a combination, because we do a little bit of everything in the hospital. We're a little bit of the emergency room, a little bit of the trauma, a little bit of the ICU, with working in the up in the cardiac areas. So it's kind of a combination of all, brings it all together, and having all those experiences brings you together, molds you into that person that's best for this job.
Almost ready for anything, anytime.
You got it. Gives you a little bit of everything.
So you guys are really looking for not a specific person, but a person with a diverse knowledge in almost everything.
Well-rounded in all the critical areas of the healthcare.
So let's talk about you for a second. So your background in nursing is not your average type of nursing. You have level 1 trauma experience. Talk to me a little bit about that. You're smiling like, oh, I knew he's going to hit me with all these questions because I know too much. So what type of specific experience do you have that allowed you to join the air care team?
Well, you hit the nail on the head. Level 1 trauma experience, experience in a paramedic, also working in the cardiovascular ICU also helps. The great thing about our team, Steve, is we have a diverse range, everyone from the cardiac ICU to working with pediatric trauma center, the trauma center where I came from, and we're all this melting pot that comes together, and we can share that knowledge and continuously improve each other to make each other the best.
So it's basically an level 1 emergency room, taking all those people, put into one, and say, congratulations, you're an air care team now, but you're flying.
Exactly.
Ready for anything at any time.
Try to. Exactly. Yeah.
So, all right. We've got you, you're important, but we have this fancy piece of equipment here. What's the name of this specific aircraft?
So this is Air Care 2.
Air Care 2.
And this is out of Leesburg. We have 4 helicopters.
Okay.
Bartow, Kissimmee, Leesburg, and then Apopka.
So these are based strategically throughout Central Florida and cover different areas so that they can get to zones in a timely manner and take care of things?
Exactly. So when we had one aircraft, we were stationed downtown Orlando, and we'd fly out to the urban areas and then back to ORMC, the trauma center. And as we expanded, we realized that the need for the aircrafts really needed to be out in the community to limit that time spent flying too. So we're already there. They're stationed out in the community, ready.
Pretty cool.
At any time.
Do you want to show me this thing? Let's go check this thing out, man. So you fly on this every single day?
2 days a week.
Okay.
So
2 days a week, bro. So you guys are like a firefighter schedule.
Exactly.
So when you go to work, you're there for a 24-hour kind of stint.
24-hour shift, just like a firefighter. We have our station, our quarters. We got our rooms that we sleep in, computers for our education, our training, doing our charts. Everything we need is there.
Pretty crazy. So you guys are basically in-house waiting for the call, and then you guys gear up. From the moment you get a call, when you're just, I don't want to say just sitting there, but you're prepping, you're training, you're studying, whatnot, and you're at your hangar, from the moment that call comes in to the moment you're up in the air, what's the average response time?
7 minutes. So
exactly.
On average, 7 to 8 minutes. That's the time that if you look at all of our flights, which we do hundreds of flights every month, you'll see it's about 7-8 minutes. From the time we get the call
that's fast.
To the pilots checking the weather, gathering our equipment, and getting to the aircraft to when we're off the ground, it's quick.
Fast, bro. So, all right, here at News 6, we've got a helicopter, Sky 6. It's not this. So tell me a little bit about this helicopter.
Well, this one's probably a little bigger.
A lot bigger,
A lot
bro.
bigger. It's got twin engines, which just means it
Goes fast.
yeah. But let me show you inside. So our configuration, we fly with a paramedic, a nurse, and the pilot. We work
Okay.
together as a team. So here's the inside. Usually the nurse will sit over here, and the medic sits right here.
Okay.
So this is where the patient is, and we load them from the back of the aircraft in and out. Let me show you that.
So it's basically an ambulance in the sky.
It's exactly that. Ambulance in the sky.
It's a tight fit.
It is. Narrow space, but you got just enough room to do what you need to do, reach all your equipment, and get the patient there quick.
So you guys basically equip this to be as minimal as possible, but have exactly what you need.
Exactly what you need, nothing more, nothing less.
Wow.
So
You said you fly with a medic and a nurse. So what's the difference between, for our viewers at home that would not understand that? So you're talking on the ground, we're dealing with a paramedic and a medic. But in the air, we've got a pilot, we've got a nurse, and a medic. So there's a little bit of an upgrade there because we're putting a nurse into this. What's the reasoning behind something like that, you think?
Well, so we do what's called hospital to hospital. We'll take, like when you had your event, when you were at the hospital.
Right.
And you were at the smaller hospital and you went to the bigger hospital. You needed a transport, an ambulance to take you there because they had more services,
Right.
more capabilities there. The advantage of having the nurse on board is I come from a background of working in the hospital.
You're already there.
So I'm an extension of Orlando Health, and we can bring that care to the patient. As for our paramedics, they have that experience in EMS 911, busy 911 systems, where they can bring that as well. And with our kind of powers combined, it creates that yin and yang.
Well, and a lot of people don't understand, as a nurse, you could provide more services to a patient than a paramedic can. Are there differences of services that you can provide than a normal paramedic, or is there a difference in knowledge?
Well, I think just the expertise. For me for us to have this job, it's a minimum of 7 years. 5 years experience plus 2 years of schooling, which is a long time. So you're getting a lot of experience. Most of our crew that works 10, 15, 20 years, so all that combined, that experience, that's what you're getting when you call air care.
Well, you talk about your experience. I know from my experience, when I was a state trooper on the road, most of my nasty crashes would be going to your hospital, and then I'd get to see you and hang out for a second, and you were working on these guys. So it's like what you said earlier, the level of experience. You're a trauma nurse. Maybe you have an experienced cardiac medic that's in there with you, and you guys kind of come together, and you're like, no, bro, I think we should be doing this. And then you guys are in direct contact with the hospital. So it's kind of win-win all around.
You got it, man.
All
You
right.
got it.
Sir, you're not going to get too far here. You're, no, I don't know. You came up here, so you're going to talk for a second. Sir, if you don't mind introducing you, obviously you're in a black flight suit.
Yep.
I know that you're the pilot. If you want to introduce yourself.
So I'm Kevin Frisbee. I fly Air Care 2 out of Leesburg, and I've been flying for 14 years now.
14 years, and what's your background prior to coming to Air Care?
So before Air Care, I was in the Army. I was an infantry guy in the Army with the 82nd Airborne. And then I learned to fly afterwards. I fought wildland fire for about 10 years out Northwest, all throughout the Northwest, Australia, in Blackhawks and A-Stars.
Pretty low-key life that you lived before coming here to Orlando. My goodness. So how would you rate your experience flying with Air Care? Because like from an outsider, I think you guys have the coolest job in the world. Get to hang out with cool people all the time, fly really cool equipment. I'm sure your past life you got to some cool toys too, but talk to me a little bit about how Air Care is different from flying previously.
So Air Care is it's very structured. It's a unique situation. You know, I went from flying in the mountains, fighting fire in the mountains, and now I'm landing on I-4 and the turnpike in the middle of people's backyards, and it's different in that aspect. You know, I'm helping people out that need the help, and my whole basically career has been service, and it's been fun to do different styles of service.
Well, when you're doing service and you got cool toys to go along with it, why not keep doing it, kind of thing? You mind giving me some specs of your helicopter? Just some general knowledge of it.
So general knowledge, this is what's called an EC-135. It's a dual-engine helicopter, so we do have the added safety of having a second engine in case we have an emergency with the other. It's more than capable to do everything we want here in the state of Florida.
So when it comes to, I noticed something that when you guys land, it is a lot of downwind happening. Educate my ignorant self for just a brief moment here. A police helicopter lands, our helicopter lands, the thrust isn't nearly. What is it? Just simply the power of this helicopter that causes that?
It's a combination of power and just how much the helicopter weighs. So the more it weighs, the more lift it has to produce in order to fly.
Okay.
So this helicopter is going to be a lot heavier than your standard police helicopter or even a news helicopter. So it's got to create a lot more lift, a lot more downwash in order to maintain flight.
Would it take, how much schooling did you go through in order to get certified in all your flight time?
So it took me, I want to say about a year and a half. And then I did the stepping stone. I was a flight instructor for a while, and then I walked right into fight and fire. I did rescue in the Tetons, California, heliski in Northwest, in Utah, and fight and fire. I've done it all.
You need to write a book is what you need to do. That'd be a really cool, or a podcast or something, because there's plenty of cool places to check out while you're out and throughout the country.
Yeah, very much so. I mean, my office view is amazing. I couldn't be in a corner office, you know. My office is always changing, and I love it.
How long have you been with Air Care?
About 3 years now.
Awesome, awesome. Well, I appreciate you, man. Trey, get back over here. So a few things I want to know. When it comes to your equipment medically in here, what kind of stuff do we have that's on board and ready for you guys at any given time?
I kind of think of it like it's a combination of a miniature emergency room and a mini ICU, all kind of combined into one.
Okay.
But let me jump around the other side.
Yeah, go for it.
So this here is our ventilator. So you guys remember during COVID when we were a shortage on ventilators and everything we needed. So if somebody needs help breathing or we have to put a tube down their throat to help, this machine will do that. This is our cardiac monitor. And this here, one of the true things, the things that I've seen affect patients' outcomes in survivability and in saving patients' lives is this right here. And we carry whole blood. So this truly, there's a few things that we could do in the medical field that actually saves a life.
So that's blood for a transfusion ready to go right now.
Ready to go. We can put it on our warmer at a moment's notice, and that's one of the few things I've actually seen a patient that's so sick and about to die and actually save their life. It's
the biggest tool you guys have on
That's
here.
probably one of the best life-saving tools we have.
Wow. I didn't know you guys carry a full transfusion kit right here on board. If you could, point out that stuff one more time for me that's up over there.
This up here is our cardiac monitor. This was our ventilator.
Okay, help people breathe and all that fun stuff.
You got it. This is just our trauma kit, all of our
So is that what I see you guys get out with when there's like a major active scene and when you guys throw those big backpacks on? Is that the backpack you're carrying?
That's it. That's the Batman
What's
backpack.
in that backpack?
We have, well, like I said, if we got to put a tube down your throat to help you breathe, this is the equipment for that. So this is your laryngoscope. This is actually a video laryngoscope, which is pretty neat. It can.
So that would actually display on that LCD screen.
You're right, and this would help us put that tube in your throat.
What a
if you gotta
time to
breathe
be
for you.
alive.
So
How cool.
we carry our tourniquets over here.
And this is just in case, right? Because if you're landing on a scene, Trey, we're talking the scene should already be secure. In theory.
In theory. So we rely a lot with our police and EMS agencies to secure that scene around there to make sure that nobody's going to inadvertently run through and crash into the helicopter or hit the blades.
But when you're picking a patient up, most times you're hopefully picking up a stable patient.
We hope so, but there's so many times. If they're calling us, they need to get to the hospital quick. That's the best asset this thing is. It's
Fast.
time.
Right.
It will cut down. the transport as opposed to driving, being the traffic
Right.
for here, how long it can take you to go by ground. So we can fly in half the time or a quarter of the time
Wow.
that it takes if you're going to drive that patient.
That beats I-4 traffic any day, anywhere. So you're basically, as the crow flies, most people don't understand, you don't have to follow the roadways. You can beeline at point A to point B without zero obstructions being in the sky.
You got it. And our air traffic controllers really help us out with diverting other traffic to clear the way for us to get directly point A to point B to that hospital.
Now, do you guys have priority in the sky?
They will. If they can
try.
give it to us, they try. And they worked really well with us.
Awesome.
How fast you go?
How fast does this helicopter go?
That's
a pilot question.
That's a pilot, but about 120 miles an hour, plus or minus, depends if we got tailwind or headwind. Or
Thanks for
whatnot.
talking in mile per hour, because I don't speak knots or any of that stuff. I'm not about to do a conversion. So cool. Let's hop on out. Want to make sure Goose, our photojournalist here, backs out safely. But you can see how awesome this is. Let's go to the other side of the helicopter here. It's funny, I'm sitting here looking for like the spotlight and all that fun stuff. Trey, you brought a nice crew with you. You got the rest of the air care crew. They always try to hide away from the camera. So I want to make sure when you've got the mic, it's the power of the mic. You can just point and be like, hi, everybody. So that's the rest of the air care team, obviously out in their signature red. So anything that you want to give out or you want to let people know about air care that maybe we haven't covered?
Well, I'll tell you this: it's Stroke Awareness Month.
Okay.
So that's one of the main things that we fly. Probably the majority of our scene calls, and the best thing your viewers can do, or you at home, if we do what's called FAST. F-A-S-T is the acronym. FAST is for face, arms. Well, let's go back to face.
Yeah.
If you notice a facial droop, or it looks like somebody's paralyzed on one side. Arms. If you have them hold up both their arms and one drifts or drops or just doesn't hold up at all. Speech. If you notice their speech seems slurred or just doesn't seem right to you, or they can't get the words out. And the last thing is time. Call 911 as soon as you see any of those symptoms, because we can fly, get them to the hospital, and there's so many interventions that we can do now. It's amazing how far healthcare has come, especially in this aspect of stroke. They can go in and get that clot out. They can give you medications to bust that clot, but it all has to do with time. And if you don't call, you fall out of that window. So we can really help save lives by doing that.
Wow, dropping the facts on us this morning. It's crazy because as you're explaining that, I think of my grandmother when my grandma died. And heck, you were around for that. And she was at home getting ready for work. And the time thing, they said if we would have been able to get to her within a couple of minutes, nothing would have happened. But because no one was home, no one was knowing what was happening, that's what led to the severe injury and then, of course, the death. But I never knew about that FAST acronym. There's always an acronym for something. So thank you for that. Man, coming in with it. More than just the air care knowledge and stuff like that.
What happens if it's behind the wheel?
What are some symptoms? Look at Goose going live with us right here, filling in some things. If someone, since we brought up the stroke awareness, what are some symptoms a person might feel if they're starting to possibly have a stroke?
Well, they might notice a headache.
Okay.
Maybe some blurred vision. Maybe they start to feel a little funny, tingling in their arms.
Okay.
Definitely call 911 if you think.
Cool. Well, Trey, my brother, I appreciate it. Give me a hug, bro. I love this guy. This guy right here has been my best friend since 6th grade. There are some stories that I wanted to say on here, but might be for a podcast or something like that for another time. He's got stories about me, and I've got stories about this guy right here. But it's been amazing to go through our careers together in different paths, and now he's got a much better ride than my truck. But I appreciate you. I appreciate the air care team. All you guys are absolutely amazing. Always doing some crazy stuff with some great equipment, but at the end of the day, you're here to save lives, and you guys are doing that. So to ORMC, appreciate you guys. To Air Care, to my buddy Trey. Guys, keep in mind, it is EMS week all week long. So if you're seeing those guys out there, those men and women out there in the medical field, you don't have to ask if they're EMS. Just assume that they're out there as part of that mission and give them a huge Thank you. So, sir, thank you again. Appreciate you.
Steve, thank you for having us.
All right. If he calls me Trooper Steve one more time, I'm never talking to this guy again just because he's my best bud. So for this special edition of Trooper Steve on Patrol, make sure that you head over to clickorlando.com, News 6 Plus, and of course the News 6 app, where we will have plenty of EMS stuff throughout the week. And of course, this will live right here on clickorlando.com. As always, wear your seatbelts. Have a great day.